that there shouldn't be any tweeting about today's event or the social media posts, unfortunately. We're still awaiting the NIHR's post-election advice on communications. For those of you that are new to the North West Coast, just a brief background. MIDAS is one of the cross-cutting themes of the Applied Research Collaboration North West Coast. We provide methodological support and guidance to deliver applied health and social care research to inform policy and practice in health and social care across the North West Coast. We provide training and resources to help build capacity and capability in the use of and critical appraisal of research methods. And we provide leadership in incorporating health equity considerations into our research. We hold expertise in systematic reviews, critical appraisal, health economics, information science, study design, health equity, mixed methods, quantitative as well as qualitative research. I've put some links in the chat for further information about MIDAS in the chat. If you scroll right up, they should be there. MIDAS has established a number of methodological subgroups, and these subgroups are supposed to provide an opportunity for people with a specialist interest to develop a collaborative network in that research specialism. And our qualitative research is one of those. The purpose of our qualitative research is to provide people with peer support and networking opportunities, to facilitate opportunities for collaboration in things, for example, in bids for research, and also to share and dissemination of information and knowledge about new issues in qualitative methodologies. And again, I've put a link to our MIDAS qualitative subgroup in the chat there. If you scroll up the meeting chat, you should find the link there. So what to expect from today? Turning to the agenda, which you all should have had, we've got an exciting array of speakers from Liverpool John Moores University, from the University of Central Lancashire, and from the Applied Research Collaboration North West Coast's own Public Involvement and Engagement Team and their Community Research and Engagement Network, or COREN for short. So without further ado, we're going to begin with a keynote presentation on realist perspectives of leadership in and integrated care systems from Lisa Knight, and Lisa's from Liverpool Business School. And I think Lisa's going to share her own slides.
I will do. Thank you.
Thank you.
Morning, everybody. I'm just going to share my slides. Can everybody see that?
Yeah, we can see that.
Lovely. Okay, great. So as Alison said, my presentation is going to focus on realist review, realist evaluation. I'm going to focus on my experience of using those methods in evaluating leadership within an integrated care system. So I'll explain why realist review and realist evaluation were chosen. I'll explore a little bit about the sort of the methodological approach, and I'll provide examples of this particular study to illustrate the key points. But obviously, the focus is going to be on the methodology and the approach. So I won't really have time to share fully my findings, but if anyone's interested in that, please get in touch, and I'd be delighted to share them. But before I start, I also wanted to thank my colleague and co-chair of the Realist Research Group at John Moores, Jane Harris. She's here today because she provided some really helpful feedback on my first draft of this. And so if anyone would like to chat to me or Jane about the Realist Research Group, please get in touch. So I'm not going to spend time talking about what an integrated care system is, integrated care boards. You all know what they are, but just the sort of important elements that in this study, it included all of the elements of an integrated care system. So the NHS organisations, local authorities, and the third sector. and I'll talk a little bit about why integrated care really. But again, I didn't want to spend too long talking about what integrated care systems were. I'm sure you're all very, very familiar with that. But what might be of interest is the kind of what I tried to do was map the drivers of integrated care in terms of policy and legislation. Part of that was to identify for me where we would start the realist review in terms of really getting into some of the detail of the literature and what's available. And you can see, you know, around sort of 2014, it all starts picking up, and there's a huge impetus there. And really, you know, given the complexity of integrated care systems, so the numerous organisations that are involved, the layers of decision making required, the importance of leadership, you know, is increasingly important. All of the national guidance and policy briefings around integrated care systems as they were being developed, and certainly from 22 since they were established in formal form. But you know, as you start looking into the sort of what's actually available, the existing literature on integrated care system leadership, it is either based on previous forms of leadership, not specific to an English context. There might be some other Western health services, but not in a kind of national health service and an English context, but actually primarily found in the grey literature. So there was a real lack of robust empirical foundations really to you know, what does good leadership within an ICS look like. So this research tried to, and I'm going to talk about realist evaluation particularly, but realist review as well. But the idea was to fill that gap, I guess, to provide some theoretical and practical knowledge, to bridge that gap a little bit, to provide useful information to ICS leaders, and also to support leadership development. One of the areas that I work in at the business school is around leadership development, hence my interest. My background is also in the NHS, so there's a nice link there for me. So it was really about trying to clarify what it is, you know, what is it about the activities and behaviours of leadership that leads to effective outcomes. So this, you know, partly it required me to understand, you know, what were the enablers, what were the barriers, and just to really unpack. And you might be familiar with the phrase, you know, what works for whom and in what circumstances, which is the realist kind of, you know, phrasing of unpicking an area. So for me, it was about understanding what works for leadership in ICSs, for who it works, and under what circumstances does it work. So I'll try to provide some examples as I go through, as I've said. But really, let's start with, you know, why realist evaluation. So realist evaluation, for those of you that have not come across this before, it's a theory-driven evaluation approach. It's concerned with developing and testing what are termed program theories. So these ideas, propositions, hypotheses about how an intervention works in practice. And the program theories consist of causal chains, described as context, mechanism, and outcome configurations. And I'll talk about those in a bit more detail as we go through. But it's essentially, as I've previously noted, about unpacking how those activities and behaviours of leadership in this context achieve outcomes. So developed in 1997, realistic evaluation was the original term, the original book, Pawson and Tilley, developed in 1997. It's grounded in realism, in both scientific and critical realism. Pawson and Tilley originally, excuse me, described realist evaluation as applied scientific realism, but it has its ontological foundations in critical realism, and I'll talk a little bit about that. So it seeks to understand how and why outcomes occur by identifying the mechanisms at play and the context within which those mechanisms operate. And you can see there a quote taken from Realistic Evaluation by Pawson and Tilley. But essentially, I'll just briefly touch on kind of the kind of ontological position and move much more into the kind of practical methodological aspects. But it occupies the space here between positivist and constructivist paradigms. So ontologically, takes the position similar to critical realism, that reality exists independently of our perceptions, our experiences of it, and that it's constructed in three sort of distinct layers: the empirical, that we see, that we experience, that we can gather empirical data, the actual, so events that are actually happening, observed and not unobserved, and then the real. The underlying mechanisms, the underlying structures that generate that observable, the empirical. And I guess that what's important, and the mechanisms are the kind of crux of realist approaches. So the mechanisms operating independently of our experience of them, but how we access them is through our experience of them. So I thought this was quite a useful summary quotation, really. This is from Maxwell's realist research, but I won't read that out. But the idea that, in this context, leadership can have a real effect in the world, and therefore is real within this position. Epistemologically, realist approaches acknowledge that our understanding of reality is mediated through our experiences, through our perceptions, through our interpretations, but that it exists independently, and so therefore our knowledge of it is always incomplete. So I've kind of dwelled on that a little bit because the importance of mechanisms is kind of central to realist evaluation, really. The idea that it moves beyond observational understandings of the world and really tries to provide explanations of why and how and in what way. So not that it is this, but really, it's this because of this. And there's a whole the whole discussion we could have about explanations of the world and how we determine whether those are applicable, accurate, false, and so on. But I don't think we've got time to go into that today. But what I will touch on is this idea of the context and mechanisms together creating outcomes. Again, the focus here, on the mechanism, particularly in that the mechanism can act as the generalizable. So if we understand what mechanism is generating outcomes in a particular context, we can then apply that to other areas. So, for example, my study was evaluating leadership within a particular ICS. But the expectation is that I've identified mechanisms that will work in other ICSs, even though the context will be different. But that would also, I would hope that there would be different contexts would generate different mechanisms and therefore outcomes. So, Pawson and Tilley try to summarize in this heuristic of context plus mechanism equals outcomes. So CMO, and you might see it CMOOC, so context and mechanism outcome configuration. So it's you can read on the slide some of the elements in terms of people being able to make choices, and that range of choices is limited, and it's predicated on the idea that programs, interventions, activities don't operate in a vacuum. They're influenced by various factors that interact, and they're complex, and it's unpredictable in many ways. So the idea of generative causation is really important, so that outcomes are not simply the result of a direct cause and effect relationship between an intervention and an outcome, but rather they're an interaction between the contextual factors and all of the mechanisms and so on. It might be a little bit clearer this is the descriptions I used within my study. So to illustrate the point, my definition of a context in relation to leadership in the ICS, a mechanism, and also the outcomes there. Give you a couple of seconds to read those. But what you'll notice is that I've split the mechanism here. So I've put in brackets there, you'll see the resources of a mechanism and the reasoning. So resources being the activities, the actions related to ICS leadership, and the responses are those, reasoning, sorry, is the responses from leaders or other members of that system. So what's their response to the resource that's offered? Oh, sorry, I've gone backwards. And so this is how I presented my context, mechanism and outcome configurations in the study. It's based on Sonia Dolkin's work. The idea being, so a resource, a mechanism resource, so an activity or process, a resource is introduced within a specific context that influences the response from the participants, from the people within that system, which in turn influences the outcome. So the purpose of realist evaluation is to make explicit these underpinning ideas, these program theories as they're termed, these underpinning ideas about how an intervention, a program is intended to work. And Pawson and Tilley described it as a recipe, a list of vital ingredients that appear to be needed for an intervention to be successful. So I've tried to describe this here as a recipe. So you identify, first, you require the identification of context, mechanisms, and outcomes. These are your ingredients. Then combine to create these configurations. So if this context and this mechanism, then this outcome. That's the configuration. That's C plus M equals O. And pulling all of, a number of CMOs together creates this program theory. So this is I'm going to get into now, well, how did this apply in practice? How did I apply this in my study? And the first thing really is to identify an initial program theory. So identifying how we expect it to work in practice. And very often that's based on the ideas that policymakers or stakeholders have about how something is intended to work. So in my case, it was about identifying national guidance and policy, lots of kind of ICS configuration documents about how leadership and governance within the organisation was intended to achieve those 4 outcomes I identified at the beginning. And just to give you an example that I'll come back to, I just wanted to show you how in practice that heuristic works. So one of the findings for me was that using patient stories in integrated care board meetings, so that's the activity, the resource, the kind of what's introduced in the context of governance meetings where actually the national target discussion was hugely prevalent because of external regulatory and public pressure in terms of access to services. So the focus was on acute access. Lots of discussion around that. So in the context of that being the focus of meetings, the introduction of a patient story served to remind the leaders around that table of the impact of their decision making, and it shifted their focus from that acute access targets to the intention of the ICB and the ICS in terms of longer term population health. So that's just to give you a sense of what that looks like, and I had ended up with 14 of these, and I combined them into 4 program theories, and I'll talk a bit more about that. And here's an example of how so you can see the top one there, patient stories. So patient stories provided a means of connecting decision making to the experience of care, and that's based on on this configuration here. And there were a number of others, so challenging conversations and also failure as learning. And that led to this overarching program theory of being. And some of you may notice so that my program theories were initially based on the NHS Northwest Leadership's Doing Things Differently framework, which was intended to be a systems leadership development framework. And I found that a really useful organizing framework. And then, and again, I'll talk about this a bit later, but again, it pulls into, you started with configuration. A number of configurations come together to create this program theory. And then there were 4 program theories about being a leader, leading and visioning, delivering, relating and communicating. And each of those had individual CMO configurations underpinning them. But this is what I did. So I started with a narrative lit review just to get a sense of, what was out there, what was the kind of, what was the, current empirical base for leadership within broadly this context. Obviously, ICS is very, very new, but, other inter-organizational and collaborative leadership systems. I looked at ICS strategic documents and guidance, and I also did 5 key informant interviews with people who had been around from the beginning of ICS's being established and kind of had a really clear understanding of the purpose and intention and what leadership needed to be. That helped me develop these initial ideas, these initial program theories about how leadership should work. So I came up with some statements about, if leaders have a clear vision, for example, then that generates, fosters unity within partners, which helps them focus on the long-term aims of the ICS. For example, that wasn't one of mine, but that's just one I've made up. But that example of how it's intended to work. And then I did a realist review of the literature, which I'll talk a bit more about in a second. And that helped me to sort of test these initial ideas, these initial rough program theories about how leadership in an ICS should work against the empirical available literature. And that helped me to revise them. And then those revised program theories it was a really complex process. And so those revised program theories then were tested within a case study ICS. I did non-participant observations of the ICB meetings. I did 13 of those, and they're about 3 hours long each. I did 28 interviews with ICS leaders, including PLACE and ICB. And I did a document analysis of all of the strategic documents that were developed in that case study ICS during the data collection period, which helped me develop these final program theories, these final ideas about how leadership works in an ICS. So I split it into 2 phases, and you can see here, so phase 1 was up to the revised program theories. So this first tranche here, and phase 2 was the empirical testing here. So phase 1, the scoping review and the narrative review, as I'd already said, and the theory gleaning interviews. So these key informant interviews that helped me understand how the theory of leadership in ICSs was intended to work, that program theory. And phase 2 was testing it against that empirical evidence. And what I've put here is this is Porton and Tilley's 5-step realist review. And the idea here is that, well, I mean, it's presented here in a very linear model, but it really, it's not intended to be linear, and certainly in practice, it's not linear. It's more of a iterative process. So, for example, actions within one step took place simultaneously with other steps. So quality appraisal and synthesis, steps 3 and 4 there. Took place at the same time in my study, and throughout the review process, sort of trying to unearth those mechanisms and how they interacted with different contexts meant that I was moving between stages all the time, really. And then when I got to my findings stage with the final program theories, I undertook further realist reviews to kind of test and reinforce the examples. So I gave the example before of the patient stories. So once I'd identified that as a mechanism, so patient story as a mechanism to achieve the outcome of focusing on population health and health improvement, I undertook a realist review of the literature focused on that mechanism. So focused on the mechanism of patient stories or storytelling and healthcare decision making to reinforce and test, I guess, that program theory finding I was presenting. And before I finish, I've got just a couple more slides, but I wanted to talk about I want to talk about realist interviews. So realist interviews were the main focus, the main data source, whilst I used document analysis and non-participant observations of meetings, as I've mentioned, they were really adjunct to the realist interviews that were the main focus. They were with leaders from across the ICS, so that included ICB board members and place leaders, including the third sector, local authority, and obviously the NHS. And realist interviews, they were real, very different to what we might consider, a standard qualitative interview. The idea is that rather than sort of constructions based on individuals' experiences, the interviewees and participants are, considered evidence for real processes and for real phenomena, linked again to that sense of 3 layers of reality. So the focus of my interviews was to confirm or refute or refine the ideas that I was presenting. And I've put up here the diagram. This is again from Pawson and Tilley's work. But it's the idea, they call this the teacher-learner cycle. It's the idea that the interviewer introduces the program theories, so introduces those ideas about how leadership is expected to work. And that the interviewee is asked to provide an informed perspective on that. So the interviewer asks the question, and then the interviewee is able to apply that based on their own experience, and then that refines the theory and then informs the future questions, either within that interview or future interviews. So whilst I had an interview schedule, an interview structure, it was very iterative again, and I changed my questions. So, for example, I got one here. So I presented. You can see here, the program theory, the CMO there. Program. This was one of my initial ones, very early on in the study. Presented that to the interviewees, not necessarily in that format, but says one aspect that's been identified is the need for a clear and sustained vision, and that this, helps to generate a sense of purpose in stakeholders and partners, and sort of presented that to them and asked for their view. It was that their experience. Did they have examples of that? And you can see there's some prompts that I've put in. And the one in red was, again, just to illustrate that was one I added based on one interview. I then wanted to ask the barriers to that to another interviewee. And I guess what's different is the unit of analysis in realist interviews is not the person, but really the events and the processes that they're sharing. So they, can reveal a number of sort of processes and micro events, and each of which you can pick out little bits and explore and use them to test the program theories. So as I say, in practice, that meant that I was sometimes asking different questions to different participants. If some people were more able to talk about context and some people were more able to talk about outcomes and so on. I'm conscious of time. I've got one more slide. So sorry, Alison, one more slide just to quickly talk about the advantages and disadvantages of this approach, really. I've barely been able to scratch the surface. It's such a complex methodology, and I find it really fascinating, and I really enjoy it. But it is very complex. It's very time consuming, resource intensive. It does require real deep engagement with the data and the theoretical frameworks, which can be broad and wider than where you originally start. And also, it may be difficult to generalize beyond the specific context of the study, although, the purpose of program theories is to help that. But it's very good at helping us understand complex interventions. It provides, I hope, relevant and useful information for practitioners in terms of, in this study, leadership styles, leadership approaches, and also leadership development. And it's very adaptable to different research environments. So, very sorry, conscious of time, I will stop there. I'm very happy to take questions.
Thanks, Lisa. I like the way that you gave the theory as ingredients. I can get my head around that one, and also the PPE, the public and patient involvement in the mix in that. That's good. Do people have any questions for Lisa? Yeah. Oh, Kirsty's giving you a clap.
Thanks, Kirsty.
Okay. Oh, Kirsty's got a question.
I think you're just on mute, Kirsty. It's bound to happen sometime.
Just always seems to happen to me. I really must get over this. Perhaps I should put a sign on my laptop. Come off mute. Silly. Yeah, I just really enjoyed your discussion, and it just started me thinking about integrated care board leadership. So my question is perhaps it's touches on your findings, but I just wondered, you mentioned about leaders having a vision, and so my question is, did you find that the board has a leadership vision, or the individual leaders have a vision, and is that part of your sort of realist questioning?
Yeah, and it's a really interesting question, because what I found was probably what's in your head, this idea that individuals did have a vision, and most of the time it aligned with their colleagues and with the kind of national vision of the intention and purpose of ICSs. But as with all things, that people came with their own background and experience and focus. And I think particularly the tensions that exist now, and that might be because of, again, the context of them only being fairly new. I mean, well, people keep saying that, it's been 2 years now, hasn't it? So, but about the tension between place and what we might call centre, I guess, place and an ICB centre, though nobody likes that language, but there's no other way of describing that, I guess. And also local authority, NHS, third sector. There was absolute tension between, not necessarily individuals, but between their vision, between their purpose. A lot of that, I touched on the external regulatory focus of acute access, essentially. That's a tiny part of provision, isn't it? And so there was a real tension there, and also I think one of the key challenges for the leadership was around, again, structurally, the context there was around the health and social care differences, particularly around, again, regulation, but funding. Local authorities are not able to set a deficit budget. The NHS is and does frequently. And it was a real, I think one of the leaders said something like, they're never going to take us seriously until we start setting a proper budget, so there's this, there was a real, so I think that the idea of a vision, there was this vision that people absolutely wanted to make a difference in population health. But it was how and in what ways they could do that based on their own context, their own, external focus and so on. So, yeah, does that answer your question? There was a lot there.
It answers and raises so many questions, but thank you. Thank you.
Well, please get in touch. Honestly, I'm delighted to keep talking about it.
Just got time for one more question. I think Kenny Finlanson's got his hand up.
Yeah, thanks, Alison. Hi, Lisa. Really interesting. Thanks for explaining a very complex topic in relatively simple language. Even I could understand it, so that's something.
Thank you.
I'm just interested in, you sort of alluded to the difference in the qualitative research approach to questioning and the interviews, and how they were framed slightly differently in a sort of realist review perspective. I just wondered how then that affects the analysis. Do you do a similar analysis to what you do in a qualitative research study, or is it a different approach?
It is a slightly different approach, yeah. I mean, I guess initially you might start off with a broad, sort of similar to thematic analysis in terms of creating the kind of big areas that you might want to look at, governance, delivery, or whatever. But within that, the focus is very much on identifying those mechanisms, those components, so the context, the mechanisms and outcomes. And so it might be in terms of the interviewing, as you're moving along, you might, I've got loads of context. People are telling me all about what's influencing and what's the kind of external factors. And I've got a bit of outcomes actually, but I'm not really getting the mechanism, what is it that's turning this into that? And so you might then focus your next interview questions on, you might change that schedule and focus particularly on, so what is it about, what are the activities, or how does that feel? What's the responses? So it's not necessarily asking generally about their experience, although you do draw on their experience. It's about them helping you identify those components. So it links to the interviews and the analysis. And I suppose I should also say that realist evaluation is methods neutral. Essentially, it's not necessarily qualitative. In the main, most people take a qualitative view, but very often, mixed methods might be, quantitative data might be more useful in terms of identifying outcomes, for example. Yeah. So there is a different analysis approach. It's very much focused on identifying those mechanisms and then try and connect the mechanisms to the influencing context and therefore what outcome that generates. It's very time consuming.
Yeah. Thanks, Lisa. Thank you.
Thanks, Lisa. I think because of time, we're going to have to move on now. It's a very interesting conversation. So thank you very much, Lisa. I really enjoyed that. And as Kenny said, I could understand that. So it's great. So next up, we've got our own Kirsty Coxton, who's a reader in maternity care, and she's going to talk about Represent Me, Northwest Coast.
Oh, thank you, Alison. I'm going to switch my microphone on as well, just to assist with that. It occurs to me, you should hopefully be able to see my slides at this point, but probably not as a slideshow yet.
Yeah, you can see them now. Yeah, that's great.
Perfect.
Thank you.
Thank you. So I can't see any chat or anything, so let me know if there's any problems, Alison, if you would. It just occurs to me that we haven't said much in the agenda about what Represent Me is. So it'd be interesting to see if after my talk it's a bit clearer. So let's make a start. So I'm here today to talk about an initiative that we started within University of Central Lancashire. I'm talking on behalf of myself and also Mary Claire Balam, senior researcher at UCLan, who's been very, very deeply involved with this. And I just want to acknowledge as well Rebecca Nowland, who started this with us as well and was helped us get the funding. So it's a talk about an idea we've had to try and strengthen some of the patient and public involvement, particularly in relation to maternity research, because we do a lot of that. So this is just a brief outline. I'm going to talk a little bit about PPI and what it is, talk a bit about my sort of thoughts about how PPI might be a little bit different in maternity care, and that although when we work in PPI maternity care, we've taken that for granted for a long time, but I don't think we've talked about it too much. So I wanted to talk it through a bit, tell you a bit about the Represent Me Northwest initiative, and a little bit about what we've learned so far. So I'm going to begin at the beginning here, and I do know I'm preaching to the choir. You're probably all very well versed in PPI, but I thought it's still useful to revisit how NIHR, which for many of us is our major health and social care funder, defines public involvement in research. So they define it as research being carried out with or by members of the public rather than to, about, or for them. And they say that public involvement is an active partnership between patients, carers, and members of the public with researchers that influences and shapes research. So PPI is really quite common practice now, and it's an expectation in health and social care research in the UK, and that's also true in the United States and Canada. And it's increasingly developing in other countries, but it's not by any means a global phenomenon. It is, though, a key requirement, of course, of UK grant funders, including NIHR, but also all the research councils will ask for this in some guise or other. And I think what we see is a broader PPI agenda now, which includes thinking about what the impact of PPI is, because it's been going on for quite a while. So people are starting to ask, how does this make a difference? What difference does it make? What are the tangible consequences of PPI? So what difference does it make for us as researchers, and also on the people who come forward and become PPI participants? And how is it affecting things like question prioritisation? And what impact is it having? Really, more recently, they have asked us to look at this on equality, diversity, and inclusion within research. So as I was looking around for this talk, I sort of came across some interesting papers. I was looking at papers on impact of PPI. And this one is looked at the impact of PPI in health research. It was by Jill Russell, I think, Nina Fudge, and Trish Greenhalgh. So people that have been working long and hard in PPI. And they said that patient involvement is an effort to enhance autonomy and resist the medical paternalism that's defined healthcare delivery in the UK. So I found that quite an interesting insight, particularly as there's the senior author here is a medic, of course, by background. Sorry, just checking my timer. So PPI in maternity research. Well, I'm starting to think that PPI in maternity research is a little different from PPI in wider healthcare. And these are some of the reasons that I think that's the case. So one main difference is that while women's voices have really been shaping maternity care for decades, certainly since the 1960s, and that's the case in America, Canada, Europe, Australia, and New Zealand, particularly. Or at least we know it's the case in those countries. It may well be the case in other areas that don't publish as much. But that's really been about women's voices shaping how maternity services are provided, rather than necessarily involvement in maternity research. And I think it's fair to say that is just a more recent development, probably since around the 1990s. But in common with other areas of healthcare, there is an expectation then that we involve women and families, not only in our research projects. The ambition is that service users should be involved in shaping the research agenda and deciding which questions to prioritise. So that's quite a challenge in maternity care, because apart from anything else, more than 600,000 women a year give birth in the UK. And many of those women are healthy, but some are really unwell. And how do we canvass this very large group of service users? And when do they stop being service users, given that the time frame of pregnancy, famously 9 months, is quite short? And then in terms of EDI, there's an ambition that PPI engagement should be diverse and inclusive. And we see that happening increasingly across the UK, but it's not yet mainstream. I think it's particularly evident in maternity care that we haven't got there yet. So PPI really is important to everyone, but there are lots of barriers to achieving this in practice. And here I'm referring to the things that you'll all have encountered, like costs. You know, we need to pay members of the public for helping us in this way and acknowledge the time that they put in. And the Research Design Service used to provide grants for this, but it no longer does. And I emailed the Research Support Service now, which has replaced the RDS, to say what's their plans. And they wrote back an email that says it's just not in their remit. PPI is, but funding for PPI engagement isn't. So I'm not sure where that's sitting at the moment. And when we do PPI, if I can use that phrase, we also need to find people who are interested in research and want to become more involved. And when they do get involved, we have to support them so that they feel confident and that they feel well supported and comfortable in a world of research which can seem quite alien. And pregnant people, of course, and new parents are often incredibly busy. They've got babies to care for. They're often working and studying, looking after other people other than their babies, and sometimes all of those things and more. So this is not the easiest population, perhaps, to include. And I think we also need to think long and hard about what we mean by representation. As I alluded to earlier, PPI often doesn't include people from those marginalised groups. People from poorer backgrounds, particularly, often excluded. Large sectors of society are effectively excluded from public involvement because it's effectively a voluntary activity, and many people just don't have the time or resource to take part in that. So there are lots of challenges, and I guess what I'm starting to ask myself is, does this PPI model work in maternity research? I'm not saying for a minute we should move away from PPI. I'm just trying to think about how the practical elements of this model and how we manage it. So I'm absolutely in support of PPI. But some of the things that are problematic are, well, PPI rests on the idea of patients, but pregnant women aren't patients. The vast majority are healthy young women with no other problems, no other conditions other than pregnancy. But of course, that's not true of everyone, and some women are incredibly unwell, as are their babies, and others become unwell as a consequence of pregnancy or birth. So we use the term patient in PPI, but it doesn't really fit with pregnant women, but sometimes it does. So the terminology is quite problematic. And the terminology is also important in terms of autonomy, because we're trying to work to a position where women's legal autonomy over their bodies is recognised within maternity services and beyond, and that's quite a challenge. So another but related issue is that in PPI, patients are often seen as the focus of care, but in maternity, pregnant women, of course, are the focus of care, but so are their babies. So that can be 2 or more if you're in a twin or triplet pregnancy, people. And transition to parenthood also involves partners, families, siblings, parents, grandparents, wider networks, neighbours. So who really should we be including in PPI when we're trying to improve our research or make it more useful to the community? In terms of the time frame opportunity, areas of PPI with probably the strongest track record include mental health and chronic long-term physical conditions. But, you know, as I mentioned, pregnancy has got a very short time frame, so there's a little bit of a mismatch between the trajectory, although obviously some people are pregnant several times and may become pregnant, you know, over a decade, a few times. So for some people, coming in and out of pregnancy and parenthood is normally a longer term, but it hasn't got a sort of trajectory of pathology, as it were, which lots of conditions have. And of course, as I said, we have to think about the burden we place on people. Parents are so busy, and we ask them to contribute at a time when really they've got the most pressure and they're struggling to stay above water. And the people that probably can come forward and help might well have a different experience of maternity care to those who are not in a position to. So I think there are quite a few questions to kind of mull over here when we think about PPI maternity, aside from what terms we should use and who we should involve. It's just worth thinking about, well, what's happening elsewhere, and what's going on at the moment here. So in the UK, well, I've just had a quick look on the NHR database of funded studies, and lots of the big funded studies have PPI co-applicants, but they're normally leaders now of grassroots organisations or voluntary organisations, and they're individuals who are very well known within maternity care, and they have often worked in PPI for 10-20 years. They've got a fantastic resource of experience and insight into, you know, many people's perspectives. But it does mean that our service users are often being represented by experienced and sometimes, and to some extent, professionalised advocates and researchers. So I feel that's drifted a little bit away from, you know, the sort of raw, fresh experience of a service user that we're trying to sort of incorporate into our projects. But in the context of developing a funding application, I came across the work of Professor Sarah Svedum in Canada, and she runs a research lab called the Birthplace Lab. And they've taken a slightly different approach there. She's very deeply involved in EDI, inclusion in maternity care, and they've created what they describe as a stakeholder council. And that is made up of groups and advocates from many different minoritised communities with maternity care experience. So I was quite interested in that model, and I want to acknowledge it as a sort of influence, as something that made me think, well, maybe can we do something similar? Can we take some ideas from that and move it forward? So for all the reasons that I've sort of been discussing, we've been working on a way of perhaps bringing together individuals, advocates and voluntary organisations working in maternity and early years services in the Northwest region specifically at the moment, to try and create something that we've described as a standing panel, which is a stable panel which carries on. It's not project dependent, it's an ongoing panel that stays there, and we touch base with them for PPI purposes. And our thoughts are that the panel is a really helpful way to get access to people who work with service users who are from marginalised backgrounds, who would never likely be able to come forward and sit on that sort of panel themselves, but whose voices and experience can be shared with us, and also provide a conduit for more detailed PPI work, if you see what I mean. So they effectively are gatekeepers for us as researchers that can lead us to other people when we need to do that more detailed and specific PPI work. So 5 minutes left, and I'm going to tell you a bit about Represent Me Northwest now and where we are with it. So we have had some funding for UCLAN through the QR. And if that's baffling, it's basically some REF funding. The universities all use their REF funding in various ways, but we had some REF funding to support this initiative. Not a huge amount, but just to cover some salaries and some of the costs of bringing people together and providing food and things. So we have set up the panel. Excuse me. I'm gonna have a drink. And it's made up of people who are recent users of maternity care, but mainly it's made up of people who work for voluntary organisations that advocate for service users. So at the moment, most of our panel members are based in grassroots organisations that advocate for maternity and early years service users. They're not healthcare professionals or social care professionals, although some of them do have roles that are analogous really to a professional role. They do a lot of support and breastfeeding support and things. So they're incredibly knowledgeable, but not employed on a professional basis. So it's around about 15% of our population in the Northwest are from India, Bangladesh and Pakistan. We really wanted to try and ensure we involve people from those communities. And we've been able to do that now after making some links with Inclusive North, which was formerly BME Lancashire. And that's a large organisation that exists to increase inclusion and representation of minorities. And we've also been working with a lead from East Meets West. Although quite a few of our panel members have various different hats, which is super helpful to us as well. And also in our area, a lot of families are managing on very low incomes. And we know it's not easy for people to help with research when they're under that sort of pressure. But some of the groups that have been working with us, such as NSPCC caseworkers, Home Start and Better Start Blackpool and infant feeding specialists have been really helping us here. So we've only started this year during 2024, but we have already about 10 different groups and communities involved. We've had our first and second meetings. The first was hybrid, and we presented one of our recent funding applications to the group and asked their ideas. And we included what they told us in our application. So the panel's already making a difference. And we recently had our second meeting, which was online only. And we're planning to meet 2 to 3 times a year, either online or in person. The panel told us that an annual in-person meeting would be valuable. And we have some funding, but that runs out at the end of this academic year. So we're going to be trying to build that up. But we included reimbursement, contribution of people's time, refreshments, and the potential to pay for interpreters and childcare should that be needed. So last slide then, learning so far. So we've recognised, for this clear from the literature and from what people tell us when we try and contact them, that some community groups just really feel research fatigue. We often ask for help, then they don't hear anything about what happened afterwards, or it's difficult to contribute because that's not really their kind of reason for existing. So they're having to come on board with what matters to us. So we're trying to be really proactive here and show how we're using the information and suggestions that people share after every meeting and sort of reinforce what a difference it is making to the people that they are advocating for and working. We found that not everyone wants either online meetings or in-person meetings, that hybrid is good, but we've learned that we need to work really hard to make it a positive experience, both for those in the room and for those online. We've learned that the approach to the use of vouchers, let's go with that, which is commonly used in PPI, just doesn't work for most of our panel members. So we need to, is that all right? There's some background noise there. We need to think more widely about what works, I think, when doing PPI in maternity care. And we've had to use a case-by-case approach, finding out what every single different organisation would find useful. It's my timer. And how best our university systems can support this, because that's a whole other question. And of course, we have to be very aware of benefits and universal credit rules affecting what we can do. So my time's out, but we have also been working to think about our boundaries and some groups that have wanted to help us but are outside the Northwest region, and we're really looking at who's missing as well.
Thanks, Kirsty. Could people turn that, make sure they're muted? We just hear somebody having a chat in the background there. Thank you. Has anybody got any questions for Kirsty?
I'm going to stop sharing.
Okay, well, I've got one just to keep the ball rolling. How do you think your standing panel will work in the longer term?
Oh, thanks, Alice, for asking. Yeah, we're really hoping that we are going to be able to continue and become like part of the furniture effectively. That's my hope going forward. But we're dependent on funding, and it's sort of small bits of funding. So I'm quite anxious about how we do that, because we have said you know, in discussion with the people that join us, we have said we are committed to recognising their time. So we can't do this without funding. And that's an expectation right throughout Involve as well, that if someone is working with you and they're not being paid, as it were, it's not their day job, then we need to recognise that. So that's really our uncertainty going forward. I'm optimistic that we will get funding from a range of sources.
Yeah, thank you. Selena Wallace has got a question.
Thanks, Alison. Hi, Kirsty.
Hi.
I'm the public involvement manager for the ARC. I've been involved in maternity services as a user rep before, so I was wondering whether is your hope that maybe you would co-create some research together based on the priorities that they've and maybe actually undertake that research as a group in some way? Is that what you might hope to do in the future?
So yes to the first, not necessarily to the second. So absolutely we want to co-create, and we're continually working with Sue and Jill and others working, and you know, beyond. We've got the Maternity Equalities Challenge Fund work that we did, which involves, you know, UCLan, other universities, several regional organisations. And absolutely we're trying to think about the information from this group tells us where we need to focus our efforts. And it shifts us from thinking, as researchers, this is what we're interested in. What matters most? What could make the most difference? So we are doing that. In terms of doing research with a group, that's not what we're aiming for here.
Okay.
Just because it's more of a conduit for shaping the agenda rather than an actual research. So it's not that particular sort of engagement, although we may well invite people from that group to become co-investigators.
Brilliant. Thanks, Kirsty.
Thank you. I've got two more people. So Bethany Gill and then Claire want to ask a question.
Great, thank you. Go. Hi, Bethany.
Hi, Kirsty. I know I probably can't go into this too much right now because of things, but I was just wondering, is thinking about like my future plans and things, is there something where other researchers are allowed to come and talk to the panel, or is this strictly for UCLan? Like, can we be invited to come and work?
Oh, absolutely. Yes. Sorry, I didn't. Yeah. I should have said that. That's really important. I can't believe I didn't say that. So yeah, that's been part of our agenda, is that we can invite people to come and talk. We tell the panel beforehand that that's going to happen, and when we did that in the very first meeting, the researchers just came for that specific part of the meeting, so that we had panel time, and then we invited researchers into the room. Yeah. And the other thing I should mention as well is Claire Selby, who's here and is talking later, has been our facilitator, and that's been really fantastic because Claire is external to us at UCLan, and she's so she has that facilitation role, which means that we as UCLan researchers sit around the table with rather than lead the panel. I think that's been really important, but yeah, that's absolutely part of what we do.
Thank you.
Thank you. And finally, Claire Maxwell.
Hi, Kirsty. I totally agree with you sort of stating that there's almost a professionalisation of PPI, but I think that's really been pushed by the funders, you know, because when you're applying, they're sort of wanting someone's experience and what they've been involved in previously, and it is really driving PPI away from what it originally should have been. So, but I think there's a real issue. So your group, I mean, obviously NIHR know about it, don't they? But what would you see in terms of this being drawn back to what it should be in reality?
Yeah, I guess I don't think they do know about it, actually, because I think it's really a local initiative, and it's something that we kind of plan to, in my mind, this could be national as well. And there are some national sort of online groups, but no kind of stakeholder council like they have in Canada. I think we do really need those inverted commas professionalised PPI people, because they're just sitting on trial steering committees and doing incredibly detailed work. And you just have to have the skill set for that. But I guess it's keeping the balance, isn't it? saying, yes, we need that when people are doing the minutiae of really complex studies. But in terms of this prioritisation, understanding the wider group, including people from marginalised communities, I think it really needs to be face-to-face and getting to know people and relational. That's what my core sense is of how we achieve that.
It's really good, you know, the sort of group that you've put together. It's excellent.
Yeah, well, thank you, Claire. It's been really enjoyable.
That's great. Have we got any more questions, or are people ready for a comfort break? Doesn't look like it. I can't see any more hands up. Okay, so we'll have a quick comfort break. If people could come back at 11, and then we've got Claire Selby, who's been mentioned before, and Selena Wallace, our next speakers. Thank you very much. Bye.
Bye now.
You'll stay for the rest of the morning. We're going to end the day with a feedback using Polypoll, which should be interesting. And then we're aiming to finish it around 12:30. So can I just take this opportunity to thank the first half of the morning's speakers. I thought that was really insightful and interesting, and I learnt a lot from that. And I think all the speakers talked about the importance of patient and public involvement and engagement in research, which is really good. And I think we're going to carry on with that theme now. Are you ready to roll?
I think so. Let me just try sharing.
Selena shares a screen and then I'm going to kick off. So yeah, thanks, Alison. Just while Selena's doing her thing, if not, I have got it as well. I can see that, Selena. Hopefully, it's coming up in a second.
You can see it.
There we go. Yeah.
Press.
Thank you. So yeah, for those who don't know me, I'm Claire. I'm the Stakeholder and Engagement Manager with the ARC, as Alison has said, and I'm going to be presenting with Selena today, who's our Public Involvement Manager. So we're given the title of Approaches to PPIE, which we've already touched on quite a lot today, particularly in ARC North West Coast. And we've phrased it around this question in particular: is public patient involvement and engagement a qualitative research methodology? Because we're aware that that was the sort of overarching the theme of this event today about qualitative research. And the reason that we wanted to talk about this is I think there are some similarities between the two, there's some differences, and we really just wanted to unpick those a little with people here today. So if you can just go on to the next slide, Selena.
There we go.
Thank you. So yeah, I'm going to pass back to Selena in a minute, who's going to talk about, we're just going to discuss briefly the approaches to PPIE in ARC and the CORAN, which is the Community Research and Engagement Network. So they are how we approach PPIE and community engagement in the ARC. And then we're going to discuss a little bit about similarities and differences between PPIE and qualitative research. There is going to be an activity to keep people awake. It's very easy, I know, to switch off and check your email when you suddenly see things pinging up. But hopefully having that bit of an activity will keep everyone switched on. So that's just going to be a chance for people to have a discussion and a bit of a think about this. And then finally, we're just going to have some examples of PPIE in research which have come up through the ARC. So I'm going to pass back to Selena now, who's going to talk about approaches to PPIE in ARC North West Coast.
Thank you, Claire. So hi everyone, I'm the Public Involvement Manager for ARC North West Coast. I'm just going to really briefly go into some background because, as I said to Kirsty about her presentation, my background was as a lay person getting involved in research before I was ever a researcher, and that was through maternity research after having my first child, who's now 21 and I'm a grandma. So and that was actually what inspired me to get involved in public health and do an MPH, and that's how I got involved in public health research. So it's a really nice circle because when I got the job to work with ARC, It was right back to the beginning to support members of the public to become involved in a large health research collaboration, which is the ARC. And as Kirsty said, there's lots of paradigms about how to involve members of the public in research. So there's loads of different ways of doing that, and there's arguments for and against all of them, I suppose. So the way that we sort of tend to work in ARC is I suppose, a two-pronged approach. We try to focus on co-production of research. And we do that by we've got about 100 individual members of the public signed up as public advisors to the ARC. And they are based all over the Northwest coast, right from Cheshire up to South Cumbria. We have no criteria for that. So the research that the ARC does is quite wide and varied. So we try to involve as many different kinds of people as possible, different ethnicities, ages, backgrounds, different kinds of lived experience. And once we've got a team, so that our PPI team is myself, Dr. Shema Hassan, who focuses on research methods around public involvement. We've got a 4-day-a-week administrator, Ruth, without whom everything would fall apart. We've also got an academic lead, Paula Byrne. And we involve members of the public in everything that the ARC does. So every research project, every PhD, every internship, and also in the way that the ARC functions. So we have what we call subgroups, where members of the public sit on our governance group, and they also attend management team meetings and the steering board of the ARC. We've also got a communications group that work with our social media managers, looking at blogs and all the different communication that the ARC does. We've got the health equity mainstreaming strategy group, which look around supporting reducing health inequalities and mainstreaming that work. And when I started off, it was actually 2020. We'll all remember that year. So as I started the work in the ARC, I was sent home from the University of Liverpool from my office and didn't return, basically. So we had to move everything online. So it was all about working in different ways with members of the public and supporting them to get involved in the work of the ARC. So every project has at least 2 members of the public, and the way that we work is to try and involve people as part of the research team. So they'll be embedded within that team and work with the project from the beginning to the end, usually. So that will be all through the different processes of a research project. So ideally, right from the start, planning the research and getting involved in thinking about methodologies, ethics applications, as Kirsty mentioned, often being co-investigators on funding bids. We'll also have members of the public co-author papers, present at conferences, you know, all the way through. But also, as Kirsty said, there are issues sometimes with that, because different communities find it harder to work in that way. That, you know, there's only we try and reduce the barriers as much as we can, so making sure that everyone can go to online meetings, so they don't have to travel if they're a carer or they've got young children. Having researchers be really flexible about when meetings are, you know, building up that relationship of trust with people and really giving them all training that they need to get involved in analysis, which you'll hear about soon from a couple of our public advisors on their videos. And I'm going to carry on. So this is just a map of some of our public advisors across the Northwest. And as Kirsty said, people can become a bit professionalized in a way, in the way that they are a public advisor. Some of our public advisors have worked on literally probably nearly hundreds of projects. You know, they might know more about research than we do, but it's actually something that we encourage. So we encourage people to be skilled up and to get, you know, to have that kind of powerful voice in our research, and that we value their lived experience just as much as the academic experience of our researchers. But it isn't possible for everyone to work in that way. So we try and have this two-pronged approach where we get involved with community organisations via our Coran. And at that point, I will, oops, that one shouldn't be in there. I'll move back to Claire.
Thanks, Selina. Yes, so I'm just going to talk about another mechanism that we have within the ARC around public, patient and community involvement and engagement, which is our CORAN, our Community Research and Engagement Network. So lots of people, I'm sure, have heard me talk about the CORAN before, but I'm just going to go very briefly over what it is in case anyone doesn't. So the CORAN first started out actually in the predecessor to the ARC, which was called the CLARC, in something called the Neighbourhood Resilience Programme. But although it's developed since those days, the objectives that it has there that you can see, it's still very much true to what it is. So the CORAN's really a hub to bring together everyone. So experts by learning, so that's obviously academics, experts by practice, so that can be practitioners, that can be people from VCFSE, voluntary community faith and social enterprise organisations, and very importantly as well, experts by experience, so people with lived experience. And we bring all those people together, and it's about developing, creating and doing research which has the potential to impact in local places. It's also about creating and facilitating a space for discussion, and also around sharing knowledge and skills. So we do a lot of capacity building, we do a lot of training as well. So I work very closely with the PPIE team, with Selina and Ruth and Shema, because it's as we say, it's this two-pronged almost approach. So the public advisors are the individuals who sit on each research project, but whereas we bring through that sort of community voice, and that's really key right across the ARC as well. If you can go on to the next slide, please, Selina.
Oops, there we go.
Thank you. This is actually a quote from Connell, who's someone who sits on our CORAN leadership group, which I'll explain in a second. And I think this says it better than I ever could really about the CORAN and what we're aiming to achieve. So Connell says it's extremely important to move away from the idea that academics are the experts and that they need to be the ones that lead on research. The idea of the researcher being an expert based at a university external to the community is being proven as flawed. The CORAN continues to challenge that. It continues to try and reduce the power imbalance between researchers and communities, and it understands the importance of community involvement at each and every stage of the research process. So that's really what we're trying to achieve with the CORAN, that real sort of equity where everyone's involved and everyone has equal power. This diagram just sort of shows this how the CORAN works at the moment. So we have, as I mentioned, a CORAN leadership group, which the people who sit on the CORAN leadership group are myself. We have 3 public advisors, so that's that crossing over into the PPI work that Selina and her team lead on. We have a research associate, that's actually Shema, who's also in Selina's team. So there's a real sort of intermesh of our work. We have some representation from the wider NAHR structure, so people from what is currently the Clinical Research Network. But really what's key to the CORAN is our 9 commissioned organisations, which you can see outlined around the edge there. So Community Futures, Cumbria CVS and so on and so forth, and they sit right across the North West Coast. And the key thing about our commissioned organisations is we pay them. We put our money where our mouth is, and we really value their insight, their intelligence, and they are the embedded and trusted organisations in an area. So just as one example, Liverpool CVS runs something called the Health and Wellbeing Network in Liverpool, and on that there are hundreds of smaller and larger third sector charity, community organisations, from food banks to women's organisations. We have, organisations that work with asylum seekers and refugees. And because they are very much embedded and trusted, we know we can ask them for insight and intelligence, but equally they can share and disseminate information for us. So that's how we currently work. But the CORAN is much more than its leadership group. It's everyone. As it says at the bottom there, it's anyone with an interest. So anyone can join the CORAN, free to join. There's no obligation to commit time or resource. And I will pop a link in the chat to how you join the CORAN if anyone is interested. Can you move on, Selina, please?
Yeah.
So really how we work is just through this, connections. We connect people up at events or through programmes of activity, and that just turns into conversations, and hopefully then that turns into collaborations. So it sounds quite simple, but in reality it takes a long time to build that trust and expertise. and about relationship building. And here are just some examples of the things we do. We do events, we do programs of activity like collaborative mentoring. We are co-developing some research, which is really led by community organisations, and we work with researchers as well to support their skills around community engagement too. So it's very much a two-way process. We have got an event coming up. I'm just going to do a bit of a plug and I'll pop that in the chat as well. But I'm going to pass back to Selena now, I think, for her take on around how qualitative research methodologies and PPIE are similar and different.
Thanks, Claire. Yeah, I just wanted to reiterate, as you said, yeah, one of the things that we do is also we pay all our public advisors for their time, and I think we're really lucky to have that kind of embedded resource structure around public involvement, community engagement in the ARC, and that's what enables us to build up these kind of long-term trusting relationships that enable better co-production. So public involvement, I would say, informs qualitative research. So it's possible to do qualitative research without having public involvement, but as Kirsty mentioned, most funding bids and funders now expect public involvement in all the research that we do. And I think you're going to be missing something from your research if you haven't got that voice of lived experience in trying to understand your analysis of your data as a qualitative researcher. But we can also use qualitative research to inform public involvement, because it's really important that we understand what we do, how we do it, and why, and why things work and why they don't. Because, as I said, there's so many different ways of involving the public in research, and if we don't talk about that and how we did it and why, then it's really difficult for other researchers to understand why things went well or didn't go well in the different ways that we've involved members of the public. So we encourage our researchers to use the GRIP 2 form, which is the guidance, a short form for guidance for how they do public involvement, and explain. Quite often you might read a piece of research and they'll say something like, oh, we used X stakeholder group or something, but they don't explain who was in that group, how it was established, for how long, how does the group run, and what kind of activities did those members of the public or groups get involved in terms of the research process. And they also sometimes don't talk about the impact or the complexities of working together as a group. So it's really important to make sure that researchers do that so that we can replicate their methods. So just really briefly, some of the similarities and differences between patient and public involvement, engagement, and qualitative research. So qualitative research projects aim to answer a research question, but involvement in a research project aims to help select and refine that question. Qualitative research follows a chosen method based on theory, and involvement has researchers and members of the public exchange views in a way that is a conversation in terms of working together. So you can see from this form, I'm not going to go through all of it, but we'll obviously send out the slides. One of the things that does concern people sometimes is whether we need ethical approval to involve members of the public, and the answer to that is usually no. But that doesn't mean that we don't need to consider ethics and safeguarding and make sure that we're working in an ethical way. When we might need ethical approval is when you're planning on producing a piece of research based on the work that you've done around public involvement. So there can be crossover there when we might need ethical approval in terms of public involvement. But I'm going to move on because we are running out of time. So in terms of the other pronged approach, qualitative methods used to deepen understanding of public involvement, where ARC has actually produced several qualitative research papers that explore co-production and public involvement. So this is just a quote around that. Critical inquiry has drawn attention to processes of legitimation and delegitimation, whereby divergent views from accepted orthodoxies can be neutralized within powerfully present cultures, such as those which obtain in everyday practices of research. Our findings relating to patient and public involvement seeking funding confirms such observations and suggests that using a collaborative process for a singular, well-defined and inflexible output should be avoided. So if we think about combining public involvement and qualitative methodologies, what that can result in is participatory action research, which is a qualitative methodology that involves researchers and participants collaborating to understand social issues and then take action to bring about social change. Co-production involves different forms of knowledge being brought together, but participatory research aims to challenge and disrupt power relationships found in more traditional research that draws a rigid distinction between researchers and people being researched. So participatory action research is usually community up. So it's about working together with the community to co-create solutions to problems so that there's ownership within the community that's supported by researchers in terms of working out solutions together. So it's a way of actually combining the two, but obviously again it takes a lot of time, energy, funding to do that really well. So it's something that me and Claire are always trying to do our best to get the ARC to do, but it's not always an easy ask. Oh, there we go. Claire, do you want to take over for this part?
Yeah, I think the key thing is we said, this is just a quick activity. I'm aware we've not got much time, so it may be this is just something for people to ponder. And if anyone wants to pop some comments in the chat, or if anyone wants to raise their hand, and we can maybe just have a couple of comments if people are interested to do this. It's really which of these is PPIE and which of these is qualitative research. And you can read them for yourself. One's about an advisory group for a research project, series of one-off focus groups for a research project on food insecurity, and finally it's about a research question refined collaboratively with all relevant stakeholders. And I think the key thing, just reflecting on what Selena was discussing, the word power keeps coming up, and I think that's something that really one of the key differences we talk about is that idea that with qualitative research, depending on how it's done, often the power still lies with the researcher. The researcher is still the one defining the question, asking for sort of, gathering the data, analysing the data. Whereas within, PPI, if it's really well done, the power is equally shared amongst everyone. I don't know if anyone wants to make any comments on that now. As I say, I'm aware we've not got a huge amount of time. If anyone does either want to pop a hand up or make any comments in the chat about your thoughts on, what these are, and some of them do cross into both, really. It's not as clear cut as it might seem, I think. But we can always take questions at the end as well on this.
I think people are shy.
Yeah, that's often the case. It's hard online, isn't it, as well, because no one wants to be the first to pop the hand up. Kirsty, did you want to come in? Thank you.
Yeah, I'm interested in your number 3 here, actually, because I think that's one which is a definite, could be either.
Yeah.
And we've recently had a funding application where that became problematic because we had acknowledged that it was partly participatory action research, but also that we were using PPI, and the funder were not happy because they felt that we hadn't seen that difference. So just to
That's interesting, actually, that a funder actually commented that I'm reflecting back to you actually now, Kirsty. Why were they not happy then that it wasn't differentiated? What was their issue with that, if that makes sense? Did they feel there needed to be a more clear delineation? Was that there?
The implication of their comments was we hadn't really appreciated. They kind of said, I don't think you understand the difference between PPI and participatory research. But I mean, that can happen because obviously applications are so long and detailed, you can easily miss things. So we had sort of clearly stated it in the project plan, and I would say in various places, but the overview, what they saw was an amalgamation that wasn't clearly done. And I think you're right, it's hard to differentiate, isn't it? Because some of that is it can be either.
Yeah, and I think Ken's actually popped that in the chat as well. I think we actually did this almost slightly deliberately, that number 1 is, quite clearly PPIE. Number 2 is quite clearly, a qualitative research method using focus groups. Whereas number 3, could fall slightly into, and actually I think Kirsty's articulated that really well, the fact that a funder's even, you know, unsure sometimes where these lines are drawn is really interesting. So thanks, Kirsty. That's a, you know, really interesting comment on that. If we move on, we do have a bit of time for questions at the end, so we could always carry that conversation on then. I think Selina's got possibly a couple of videos to play. Is that right, Selina? Hopefully with the sound working.
Yeah, fingers crossed. I'll try and get it to move on. Right, I'm going to move this video forward because it's quite long and try and start it at 2 minutes 10. So these videos are a couple of our public advisors talking about their experiences of co-producing qualitative research projects. So as I said, we try and involve people in all the actions within a research project, and that includes collecting data and analysing data. So that's what they're talking about here, and we'll fingers crossed that it's going to work.
So it's saying it's recording from my side.
I'm going to move this to 210. Could you hear that, Claire?
Yes, we can. I could, yeah.
Right, okay. So I'm going to move this to 210.
Public advisors to
this is Jamie.
To be able to have some hands-on experience of using like software, qualitative software like NVivo, to also get have an understanding of how to use that sort of software to do qualitative research, etc. And
that's really good.
Yeah,
thank you, Jamie.
That's it, yeah.
That's brilliant. And just to say, how important do you think it is for public advisors to be involved in qualitative research, like your own experience? How important it is?
I think it's very important because it gives a different perspective in terms of, for quite a lot of the time, yeah, I'm not saying researchers are important, but a member of the public can have lived experience of a condition or health condition, and sometimes their input can help shape the way research is, because it's all about shaping research to provide better care for the patient. So it's important to have patients involved.
That's brilliant, thank you. And it's great that you managed to learn new skills through your involvement in qualitative research. Amazing. And especially that you're saying that you've done a lot of thematic analysis in the process, which is great. Any last messages would you like to share with the audience, Jamie?
Yeah, to not be afraid of getting involved in the analysis process. Really, don't just think that because it seems complex, really, because I haven't got a background, a university background in research, etc. But I should be afraid of getting involved in the analysis stage, etc. You may pleasantly surprise yourself. It's not only just qualitative, there's quantitative as well, and you don't know what skills you have underneath, and just go for it. Yes, it will be a learning curve and a learning process, but you don't know what skills you possess, and it doesn't matter how academically bright you are, or etc. You don't know what you have in you.
Oh, that's brilliant. Thank you so much, Jamie. I really appreciate it.
And then this is second one with Hillary.
It's loading. So it looks over from my side that it's recording. Should be able to be saying recording with you as well now, Hillary.
It doesn't say recording, but... Oh yeah, it does now. Sorry.
That's fine. Okay. Is it me or you just frozen? No, you're working now.
Sorry.
So it's fine. Right. Okay. Thank you, Hillary. So I think the first kind of question to ask is if you can tell us a little bit about your experience as a public advisor and your involvement in qualitative research.
Okay. Well, I've now had involvement in qualitative research several times on different projects, some within ARC and some external from ARC. The first time that I did it, I mean, I didn't know anything about how to do coding or anything like that. And in fact, it was you, Shema, that showed us what to do. I have some problems with technology, being an old duffer, and I find it easier for me if I do printouts and I go through transcripts and things like that manually and using highlighters. I think it tires me less because I'm not using the screen all the time, and it I just think my brain functions better like that. But yeah, it was completely new to me, and now I feel that I've really got the hang of it, and I've always enjoyed doing it as well. Yeah.
That's brilliant. And how important do you think it is for a public advisor to be quite involved in qualitative research?
Oh yeah, I really do think it is, because it's about perception, and the researchers are very involved in their research, and a public advisor is looking from it with fresh eyes from an external viewpoint that's not research based, and I think that allows for different perspectives. And sometimes, I mean, I've had experiences where what I think I'm saying and picking up is glaringly obvious, but others haven't done, researchers haven't done, and I think that's because of their level of deeper involvement. So bringing a public or patient perspective to qualitative research, I think, is very valuable. I think it also offers, if you're doing things like interviews, if you've got public advisor involved in an interview situation, it can often make the person who's being interviewed feel a bit more comfortable as well, because you don't feel like you're the only one in the room that hasn't got some high flying education or whatever. So yeah, I think it's very important.
Oh, that's brilliant insight. Thank you, Hilary. And I think the final question for me is basically to say, what would be your takeaway message for our audience?
Right. I think getting a public or patient perspective on research is extremely valuable, and it enhances what the work is all about, I think. And I think as we are generally funded for this research by public money, bringing the public perspective is quite vital. It keeps everybody's feet on the ground. It keeps the eye on the ultimate prize and the bigger picture outside of academia. So yeah, that's my take on it.
Brilliant. Thank you so much, Hilary.
Brilliant. So I think at that point, I don't think there's a better remark for us to end on. You know, keeping our eyes on the prize and the big picture, and that's how we do public involvement in the ARC, and we welcome any questions.
Thanks, Selena, and thanks, Claire. Do people have any questions on the presentation? Well, I've got one. In terms, and the NIHR and other funders not only ask us to demonstrate how we're going to involve patients and public in our projects, but also what the impact is. So could you give us any insight into how we should be capturing the impact of patient and public involvement in our research?
Yeah, as I mentioned, we have done a bit of training for researchers around using this GRIP2 tool, which is basically just a short form that's published within a research paper that gives a bit more detail about how public involvement has done and what the impact was, but it doesn't really tell you how to go about collecting that. There's another tool called PIRIT, that was designed by in co-production with researchers. I think it was with Mary Curie. I can put a link in the chat. And that is it encourages people to reflect after every kind of meeting that you have with the public afterwards or together about, you know, what was brought up in the meeting and what might you do differently or change in the research based on that, so that you got an evidence trail all the way through, so that when you get to the end you don't go back and think, oh, what was the impact of all that 3 years worth of meetings, you know. So I suppose it's about being, you know, reflective, and we also we slightly modified the GRIP too. Some of our researchers did, and we've published about that work, because the way that the art works, as Claire mentioned, is as multi-stakeholders. So it's not just members of the public working with researchers, it's also our member organisations, practitioners, clinicians. So GRIP 2 is usually just a researcher reflecting about the impact of public involvement, but what we suggest is that the team, the multi-stakeholder team, sits down together and works out together what they think the impact and involvement has been in that project, and designs that together, rather than it being a top-down approach from a researcher. Don't know whether you want to add anything there.
Yeah, what I'd say is, and in a way the current is slightly different sometimes, is that we're trying to sort of match up often researchers and community organisations, and we do that in, as I say, sometimes it's just a quick conversation, sometimes it can be a more in-depth introduction, but I often describe it's a bit like ripples in a pond. You sometimes just don't know where they've gone, and I think that's one of the hardest things to trace, really, is that sort of impact. And we are doing an evaluation of the current, an academic evaluation. You know, it's gone through ethics, as Selina said. It's important to add to that, you know, that body of evidence around what works and what doesn't. And in fact, Bethany is on the call, one of the researchers who's working on that. So Bethany, I don't know if sort of putting you on the spot, whether Bethany's got anything to add, but I think it is critical to evidence that, because then it is that what works, what doesn't work, what you need to do more of. But I think impact is one of the hardest things to capture, just because, as I say, it's that, you know, that ripples in a pond effect that sometimes you just can't capture, essentially. Bethany, sorry, as I say, I popped you on the spot a bit. Is there anything you wanted to say from working on that evaluation?
Yeah, I think, do you know, I know so I work for the ARC as well with Claire and Selina, but it's always really, it's always a good reminder to come and hear you both talk and think back to why we're doing these things. And as you were saying this, Claire, I was thinking, well, we're in a bit of a catch-22 with the current evaluation, because due to this having to be something that we had to do and we haven't got any like external funding for it, we've had to basically do it on what capacity we had in a pragmatic fashion. And yes, we've done, I would say, potentially more consultation than collaboration, like thinking about what you two have described. And again, it's thinking about, right, well, you know, that's what we've done this time. We've reflected on what we've done. We've got some really good learning from it, and we've met the academic need and the evaluation need. But if we were to do it again, how could we potentially move on that, you know, on that line that you put up, Selina, we're thinking about, right, can we move from PPIE and qualitative to qualitative and PPIE next time? So I think it's, you know, there's always room to improve and think about how we shift that power imbalances that you were talking about, but within the constraints of what we've got available to ourselves in research land.
Yeah. We'd always love to do more, wouldn't we? Thanks, Bethany. Now that is really useful. As you say, coming to these things makes me think. I think there's always that time to reflect. So yeah, thank you.
Thank you, all of you. That's great. Even the person put on the spot.
Thanks, Bethany.
Okay. If there are no further questions, then can we move on to Dr. Claire Maxwell, Jane Harris, and they're all doctors. Jennifer Germain from John Moores University. Are you there,
Yeah,
Claire?
I'm going to share these. I'm going to share these slides for Claire.
Brilliant.
And Claire, if you just want to let me know to proceed on each one. Guys.
Thank you, Ethan. Thanks. Okay, so first slide. Yeah. So today we're going to give a synopsis of online research methods, and look into the world of sort of ethics and participate using these methods in terms of qualitative research, mainly about mixed methods. As presenters, we sort of met as PhD students, and we all undertook online research methods as part of our PhDs, but we've also gone on to undertake online research methods throughout sort of our post-doc research careers. Next slide, please, Ethan. Okay, so just a little bit about our OMG. So we met at a faculty conference in 2016, quite an apt theme, organic collaborations, because we're actually all at different stages in terms of our doctoral studies, and we were actually in different schools. We've sort of slightly merged since then, and we met monthly to discuss methodological and ethical considerations of online research. Just to sort of note, it was a very different world then. It was 2016, not many people undertaking online research methods. The university, LJMU, wasn't that experienced in terms of ethical considerations around this. So in a way, and Jen was a little bit ahead of myself and Jane, Jen was sort of the trailblazer, and all her rebuttals we took on board in terms of ethics and moved things forward. So oh, sorry, if you could just go back, Ethan. So we've undertaken some collaborative papers, one in qualitative health research, and we've done a SAGE Methods online case study in terms of using online methods. And we've shared a lot of experience and guidance. We present locally to our PGRs, regionally at this, and we've done some national collaboration as well. Where I just got to mention this, we are at the moment working on a study entitled Fantastic Breasts and Where to Find Them. Sorry, you two, I just had to get that in. And what we're looking at now is where researchers actually source online data, and this is in relation to breastfeeding. So if you can just do the next slide, please, Ethan. Yep, so this is just a tiny bit about our background. So Jane undertook a study around YouTubers' public health messages to young people. So obviously there is a large online presence there, and in terms of usage. Mine was bottle refusal by breastfed babies, and as we know, parents, in particular mothers, have a phenomenal presence online. Jen had a bit more of an underworld theme here. She looked at unlicensed weight loss drugs. So again, really what I'm trying to say here is that all of our sort of groups, our populations naturally were online. And then Sean, who was part of this group at the time, he looked at becoming a father, and fathers are quite overlooked in terms of support in person. So this was an online group. Next slide, please, Ethan. So just during this session, we're going to work through some scenarios to consider the ethics of online research. So please do use the chat button as we go along. We're going to discuss the challenges of sampling from these enormous data-rich environments. We're going to look at any barriers to recruiting online, some methods of collecting and analysing online data. So the rigour should still be the same as you would collect any data. And then obviously we'll have some time for Q&A. And next slide, please, Ethan. Jane.
Thanks, Claire. So online data sets can come in different forms, and there's what we call big data, which uses data mining or scraping to create kind of large data sets at whole platform levels, whether that's across Instagram or Twitter or Facebook. And these are all about volume, and they tend to be visualized in quite quantitative ways to identify trends over large populations. So techniques like social network analysis or sentiment analysis or social influence analysis. But I suppose what we want to focus our attention on today is what I suppose you could call small data. So it's about more purposive and focused data sets that are collected and analysed in a detailed and thematic way to help us understand particular health issues. Next slide, please, Ethan. Thank you. So I think it's important to make this distinction at the beginning between taking research methods that we use on person into the online environment. So for example, online interviews or online focus groups. So in the case of qualitative methods, we know that this area of research has grown in popularity since the COVID-19 pandemic. And it's got a history in the academic literature that spreads back decades further than that, really, particularly for participants who perhaps have had physical or financial barriers to speaking in person, or maybe want to retain some sort of anonymity for a variety of reasons. So that could be stigma or participation in illicit activities. So for my PhD, I did interviews with influencers via Skype, and that just seems so antiquated now, doesn't it, when we're using Teams on a daily basis? I mean, I can't remember the last time I made a Skype call. But with these methods, I suppose what we say is the ethical issues are fairly straightforward for an experienced qualitative researcher, in that they can often be similar to the things you would consider for in-person methods. But the area that we kind of want to focus on today is the second category, which is research that's on and in the internet. And this includes methods such as digital ethnography, nethnography, or virtual ethnography. So these terms are essentially describing the same thing, which is accessing and analysing information people have shared on online platforms, such as social media or blogs or vlogs or forums, to increase our understanding of health behaviours. Next slide, please, Ethan. So one of the important things that we wanted to cover in the session today was ethics. So being health researchers, this was the first big question for all of us, and something that I think really should be considered with online research, no matter what discipline you come from. So we all had a strong rationale in terms of our topic for wanting to collect data from online communities. But the question, I suppose, is just because that data is available online, does that mean that we as researchers should take it? So Claire, Jen and I all sought ethical approval from the Liverpool John Moores University Ethics Committee. But despite the similar methods that we were using, we had really quite different experiences of applying for ethical approval. So just as an example, Jen had approval to use verbatim quotes from online sources in her research, but by the time Claire and I were applying a year and a half later, the committee position had changed and we had to take extra steps to anonymise our data. So now, I suppose online research is becoming more mainstream, especially in response to the pandemic and lockdown. Research ethics committees are becoming much more au fait with these kinds of ethical issues for online research. However, in a recent scoping review we undertook, we did highlight that there's still no standard ethical guidance for online health research, and health researchers often pick and choose which guidance they follow. Next slide, please, Ethan. So one of the major turning points for online research ethics really came before COVID and the pandemic, and that was with the Cambridge Analytica scandal in 2018. So guidance for online research, it existed long before this point, with the first Association for Internet Research Guidance published in 2002. However, ethical practices still varied, and some disciplines didn't even really think that ethical approval was required for this kind of research. So Cambridge Analytica changed this to some extent. So I don't know if you're familiar with this, but the company basically harvested data from 50 million Facebook profiles to create psychological profiles and then target the Trump campaign messages during the 2016 US election. And this had two impacts on online research. I mean, firstly, lots of social media sites shut down their API in response to stop kind of commercial and political exploitation of their data, meaning that a lot of the social science research that had been happening for the last 2 decades couldn't carry on. But more positively, I think it also made the public begin to ask questions about how big tech was using their data and think more seriously about what they searched online and what their right was to privacy. Next slide, please, Ethan. So as I just mentioned, the Association for Internet Researcher published their first edition of their guidance for online research in 2002, and the British Psychological Society published their first guidance in 2013. But there isn't always agreement across guidance, and often it's a case-by-case decision that's recommended. So I think what we'd say from our experience is that this type of online research is an extremely useful method to use, but it shouldn't be seen as the easy option, with it just being a case of there's lots of data out there that's just available for the taking. So Jen, Claire, Sean and I published about our experiences of doing this kind of research, and we've highlighted these 4 main ethical issues that we think you need to consider. So you need to consider whether the data would be considered public or private, if we need to seek consent to use the data, how you protect people involved in the online community from harm, and should we quote directly from these communities or not. So I'll hand over now to Claire, I think. Is it you, Claire?
Yep. Next slide, please, Ethan. You can just keep pressing. So public or private? So public space is quite difficult to define online. Posting on online forum posts, they're obviously going to be public, but people are posting from the private space of their own home, and it might sound quite obvious. However, posts and tweets can go viral very easily, and often this is to the total surprise of the poster, and that really shows the unpredictable reach of online content and this very grey area, this fuzzy area in terms of public and private space. Next slide, please, Ethan. Oh, okay, so this is, you can just put something in the, oh, that's it, just something in the chat. So you want to collect data from an online forum discussing illicit drug use. Do you need to gain consent? If yes, who from? And what are the issues of gaining or not gaining consent?
I think you've jumped ahead, Claire.
Oh, have I?
Yeah, should be on scenario 1.
Oh. Oh, just go back, Ethan.
Sorry, 1 second. Let me just
All right.
find the space again. So scenario 1, was it? Sorry.
Yeah.
Okay.
Oh, yes. I'll read it out. So you want to access posts for your research from a closed Facebook group. You're not a member. What steps do you take before you access the data? So if people want to, if anyone wants to put their hand up or put something in the chat around that. And this was actually pertinent to me because a lot of breastfeeding groups that I wanted to access were actually closed groups. So some of them I joined anyway because I'd breastfed, but others I was joining as a researcher. But you know, think about the ethics of then obtaining data or collecting posts whilst you're on those groups. So I won't look at the chat, I'll just go on to it because we've not got much time. So really, you'd need to get ethics to actually say that you're going to collect data from a closed Facebook group, but you would, or there's something called netiquette, and that would be going to the admin member or the lead in terms of the Facebook group and asking whether you could access those posts. And just remembering that closed groups are closed for a reason, and sometimes people really don't want their data out there, and that's really what happened to me. So that's just something that you've got to accept. If closed Facebook groups don't want you to take their posts, even though you've got ethical approval, you should adhere to that. Interestingly enough, I couldn't access the post, but then people got in touch with me from those groups to sort of say that they wanted to voice their opinions around my subject. So that's something that you've got to navigate. Next slide, please, Ethan. Yeah, so there's this sort of continuum here in terms of public to private debate. So the concept of public and private is not binary, as you can see. Online communication can be simultaneously public, but also in private, as I said before. And in a qualitative study that investigated UK social media's views on the use of their data and research, there was a similar divide. So some posters believe that if you put something out there that you know it's in the public and it can be used, and you automatically consent to the use of your data, whilst others argued you should always be consent should always be sought for reasons of common decency and intellectual property. And Elm proposes the notions of online privacy exist on this continuum from public to semi-public, accessible to anyone but requiring registration, semi-private, so you need a formal requirement for membership, and then totally private. So again, these fuzzy boundaries are evident here. Next slide, please, Ethan. Is that me?
Oh, that's me.
All right.
Thanks, Claire. So this second scenario, so this one comes from my PhD. So this is, you want to collect data from an online forum discussing illicit drug use. Do you need to gain consent? If yes, who from? And what are some of the issues of either gaining or not gaining consent? So we'll kind of go through this quite quickly, but if anyone has any thoughts, please do put them in the chat. But as Claire and Jane have both kind of alluded to, things have changed a lot since we did this research and since I did my PhD. So when I first started this, I very kind of naively went in thinking, well, online forums are public. I'll just go in and take loads of data. I don't even need ethics for this. And then I spoke to someone who said, well, if you want to publish, you should get ethics just in case. Went through the ethics committee, had a lot of kind of feedback and back and forth in terms of what I could and couldn't do. which then changed again when Claire and Jane came to do their study, but then really got me thinking about some of these complexities and some of these debates. So next slide, please, Ethan. So you have a lot of choice really in terms of gaining consent. So you can gain consent from forum moderators or forum leaders. You can look to gain consent from the users of the particular forum or social media. You can look to gain consent from both or absolutely none at all. And this is really linked to that public and private debate that Claire's already mentioned. So that decision to gain consent should be considered alongside whether participants expect to be observed or not. And I saw Selena put in the chat around there being a real reluctance for researchers to join closed groups and closed Facebook groups in particular. But I think actually there's increasingly a reluctance for researchers to come on to any online community, even if public, because they are seen as those online safe spaces. And that distinction's blurred anyway. So it's really difficult to define an online community, and it's really difficult to define whether that's public or private. But we would always say safely, if you can't kind of safely say that that data is in the public domain, you should always look to gain consent, at least from the forum moderator. So that needs to be considered along the potential to cause harm. Could dissemination of that data identify particular individuals? And you need to consider how to anonymise that data. And that's heightened when, for example, in my study, where people are discussing illicit or illegal activities or sensitive activities. And then what if users found out that their words had been used in research? So not from the online analysis, but from interviews I did later on with forum users and moderators. Some people had expressed how they'd found their comments in previous research and hadn't liked how they'd been represented in that research, and the fact that no permission had been sought for that was something that really upset them. Bless you. And then some of the issues of kind of gaining consent. So there's an impact on quality of research, and you may lose data. So it may become, you may get no responses at all from participants. So those responses may become really, really fragmented and disjointed and lose a lot of meaning. It could result in you getting banned from the community. So there were some forums that I approached asking if I could research their forums, and I just got an automatic ban, and that was that. Nothing I could really do about that. And then where you are harvesting that data and looking retrospectively, if you may be looking over a few year time period, are those users still members? So if you ask for consent, are they going to reply? Are they still accessing that community at all? And then, of course, issues of not gaining consent, we've kind of already touched upon. So participants' rights, their kind of confidence that they're using that online space for one thing and then going to have their words used for a completely different purpose, and also issues around having rights to withdraw. So next slide, please, Ethan. I think it's back to Jane.
Yes, thanks, Jen. So this is just our final scenario to have a think about. And as we said, if there's any comments, you can pop those in the chat as well. So for this scenario, it's what potential harm could you cause by publishing information from an online forum? So if you've captured data from an online forum, do you then include those posts as verbatim quotes in any publications that come from it? Or do you paraphrase them to maintain anonymity? And this was an issue that kind of touched on this before, that it differed in the advice that Jen got compared to what Claire and I ended up doing. And I know as qualitative researchers, it can feel quite uncomfortable to not use verbatim quotes, to paraphrase or change the words of our participants when we're reporting them. There was also concern, though, that you could then trace those quotes back by popping them in a search engine. So we kind of came up with this middle ground, which was what we call Google proofing our quotes. So we popped them into a search engine. If that search engine produced a direct link back to the forum, we then started to paraphrase kind of insignificant words firstly to see if we could reduce the traceability and use them in our research. Next slide, please, Ethan. Oh, sorry, yeah, again, please, thank you. So now that we've considered some ethical issues, I suppose the final time we wanted to use to look at how we go about selecting data from online communities. Next slide, please, Ethan. So this is a quote from Cosinetz, the author of Netnography, which has been published in several editions since the initial one in 2002. But I've just put this quote to illustrate that this kind of online research can often produce the opposite problem than when we're carrying out more traditional forms of empirical research. So often as qualitative researchers, we spend a lot of our time worrying about things like, will we get enough participants to take part? Will they have enough to say to give us the rich data that we want? But in online research, sometimes we have the absolute opposite problem, which is that there's actually huge amounts of data. And once we've considered the ethical implications, it can be relatively easy to obtain that data. So the question is, how do we avoid information overload and make decisions about which kind of data we want to pursue? Next slide, please, Ethan. Sorry, next slide, please. Thank you. So I've just put this example from my PhD research, which again looks really dated now, doesn't it? But this is just to illustrate that point. So my research looks at YouTuber related health content. And if we look at this example, we can just see all of the different types of data that this online research can produce. So with the red arrows, we've got all of the quantitative measures that are available on just one video, like the number of views, likes, dislikes, subscribers, and comments. And with the blue arrow, we've got the qualitative measures. So you can see this video produced 23 minutes of recorded content, which was transcribed. We've got the comments, and you can see this one had over 18,000. So when you think that some of the YouTubers in my study sample had over 4,000 videos, you can see how quickly this can become an unmanageable data set. So for this reason, we do need strategies to try and cut things down, or as COSINET describes it, to find data that is on topic and off topic. So Jen's going to talk you through the process of this for her research next.
Thanks, Jane. So I'm just going to run through, as Jane said, a specific example of how you could search for online data. And this is just one way of doing it. This is the way I did it. It's not necessarily the only way. But I think, as Jane kind of said already, what's really important is that there is a process and there is a kind of strategy to selecting that online data, not just going to the first online community you find and running with it, or not becoming completely oversaturated with data that you don't know how to analyse and what to do next. So this work's based on my PhD, and that looked at the female use of unlicensed weight loss drugs. So this was a 3-stage study comprising an online forum analysis and then interviews with both forum moderators and users of the forum and also users of weight loss drugs. So at that time, there wasn't really one specific community online where people were discussing those drugs. If I'd been looking at something like steroids or other enhancement drugs, there did exist kind of 1 or 2 online communities where everyone went to get their information. But we didn't really have the same thing for online weight loss drugs. Instead, what we had was pockets of conversations happen across lots of different online platforms. Again, also at this time, not a lot was known about who was using these drugs outside of bodybuilding communities. So I wanted to take quite an exploratory and open approach and not target specific communities and specific groups from the start. But I did use quite a systematic approach to searching. So it needed to take into account 3 different drugs. So the 3 main drugs I looked at were dinotrophenol, sibutramine, and rimonabant. I wanted communities that had a large female presence, or at least where females were posting, and ideally those that were based in the UK. So I searched for those 3 drug names, and I also searched for trade names and slang names for each of those drugs. And then I also did some general searches for things like weight loss pills, buy weight loss drugs online, that kind of thing. Searches were initially carried out on Google search engine, and I took the top 30 web pages from each search. So I had around about 330 websites to start with. And a large number could be excluded pretty much straight away. So often the links were to adverts for the drugs or people selling the drugs rather than online communities. And then often the same community came up multiple times across different searches. And I kind of liken this search strategy to some of the steps of doing a systematic lit review. So I've got set search terms, inclusion, exclusion criteria, set date parameters, and then assessments of each one of those communities to how well they fit and how well they help me answer my research question. So next slide, please. So although this was for a qualitative piece of research, as Jane and Claire know, my kind of background is in surveillance, so I can't do anything without making a spreadsheet. So I had lots and lots and lots of spreadsheets. So I spent a lot of time collating and collecting information about each online community, looking for those that had the right type of discussion, had enough members using them, were busy, had lots of discussion, and as I said, had that good proportion of female users. And I think the stages involved here will be different for every study, and it might not need to be quite so expansive and quite so big. But as I said at the start, for me, there wasn't that one community that exists. It was that discussion was spread out over multiple communities. But I know others who have done research and where there are one or two key communities that everyone uses. So yeah, you're probably not going to need quite as many spreadsheets as I did. But it is worth using that time and considering what online communities to use, what different types of discussion and different types of populations and users use different communities, and not just seeking out the first one you find. So thinking about, do different online spaces offer different perspectives? Are there any different ethical implications of different communities? And how best does each one of those spaces help you answer your research questions? So next slide, please, Ethan. So of my 300 plus forums that I found originally, a large number were excluded. So there were a lot of duplicates, there were a lot of non-English forums, and some got taken down in between searches, and others were talking about drugs, but not always for weight loss purposes. So dinotrophenol, for example, is used to make explosives and pesticides. So some forums I found were being targeted at chemists or scientists who were discussing it as a research chemical rather than for its weight loss properties. And again, it was like that systematic review where you do that initial sifting of papers and get rid of quite quickly the non-obvious ones. And next slide, please. And then another thing you may want to look at is to look at different search engines. So all search engines use slightly different algorithms to dictate both what results appear and in what order. And that's influenced by things like how popular the website is, the number of shares on social media, and number of clicks onto that website. But it can mean that different searches across different search engines can produce different results. So like a systematic review where you search different databases, again, you can use different search engines. So I did all my searches initially on Google, but then I replicated them across Bing and Yahoo and found an additional 12 forums to potentially include. And next slide, please. Something else that you may want to consider and may be useful is looking at statistics relating to that particular community. So some of this you can get from the forum itself, so things like the number of members and the number of posts, but you may also want to look at things like the demographics of who's using that online forum website, where those users are based, and what people search for in order to find that community. So at the time I did this, I used something called Alexa to kind of run all my website analytics. And that's a data tool that provides information on traffic estimates and ranks. Sadly, I think Alexa it stopped being used in around about 2021. But there are lots of different tools now available. So I think there's one called SimilarWeb and there's one called SEMrush. But if you just Google website analytics or website traffic checkers, there's quite a few to choose from. And next slide, please. So, and then again, for that systematic review, you'll have that final list of inclusion/exclusion criteria. So for me, having forums with that high number of female users was important, particularly for this particular group, as previous research was limited, but what did exist had focused on male-dominated communities. I also tried to find forums where I could easily pick out female users within that community. And this was quite tricky for some, but for lots, there were kind of examples of where people would post logs of their weight loss, and that would include things like their sex and weight on their profile. I also wanted representation of each of those different drugs and a mix of different types of forums to try and identify different types of users. So I had things like fitness forums, so people involved in fitness competitions, and parenting forums, those that were just kind of using as general weight loss. And as kind of we've already mentioned, I wanted those publicly accessible forums where I could search without an account that were popular and busy. So I picked 10 forums altogether, and then I carried out those searches again within each forum. So I ended up with around about 660 threads and then thousands and thousands of posts to analyse. And as I've said, I think for my study, and this kind of method was needed, it possibly doesn't need to be this detail for every single study. It'll just depend on the population and type of research. But I think one thing all of us would say is spending that time deciding on which communities are best for your research will be beneficial, and kind of how you're then going to use them and analyse them, and then the ethical implications of using that particular community. Next slide, please. Is it back with you, Jane?
Yes, that's me again. So what we've looked at there is data collection and analysis. So we've got an ethical and systematic process for collecting data. So how do you actually go about doing that? So we just wanted to give you some sort of tips and tools that we found useful as we've learned about this a bit more. Next slide, please, Ethan. So one option can be to collect the data manually using screenshots, copy and pasting, etc. But for larger scale studies, that can be quite time consuming. So we just wanted to highlight that there are tools out there that can help you to do that. Some of those are built into existing software, including NVivo, and I'll come on to that in a minute. But there are also a lot of specialist tools that have been developed. So on the right, on the picture on this slide, is the Digital Methods Initiative at the University of Amsterdam. And they've got a whole range of tools that can help you scrape data. So I've used their YouTube ones in the past. A couple of things just to say about these tools though. So firstly, they won't always do everything you want. And sometimes it can be a little bit of trial and error. So sometimes you have to use a couple of tools in combination to get exactly what you want. So as an example, with my YouTuber videos, I use the Digital Methods Initiative YouTuber tool to get a list of every video that a YouTuber produced and information on things like the number of views, the number of comments for screening. But then I had to use Encapture and NVivo to actually download the videos and comments. The second sort of word of caution to say about these tools is all of the examples that we've put here on this slide are free examples that have been developed by academics for research purposes, and so they've been covered by the legal and ethical departments at the universities. There are also a lot of commercial tools out there that you can pay for. Social media companies don't always want you to scrape their data, and in theory, using those kinds of commercial tools could cause some legal issues if you did it on a large scale. So as Cambridge Analytica showed, a lot of companies kind of closed down their API and many of these tools stopped working. So things are looking a bit more promising, and lots of platforms are now open research programs. So Twitter and YouTube now have programs where you can apply to gain access to their data sets. But just I suppose a word of caution when you're scraping this data online. And next slide, please, Ethan. And here we've just put some suggestions of tools that you can use to analyse the data. So you might be familiar with some of these. Some of them are just sort of standard qualitative research packages that you can use in conjunction with social media analysis. So you can see there's lots of different examples here. We've got network graphs, we've got visualizations, you've got semantic analysis. Just to point out at the bottom there, we've got NVivo, which I know is free to many staff in universities. And you might be using this already, but NVivo has got a specific plugin, which is called Encapture, and that allows you to scrape data from certain social media sites. So that's a really useful place to start if you're already familiar with NVivo and think you might want to use some of these methods. Next slide, please. Oh, this is over to you, Claire, to finish up.
Yeah, so I hope that's been useful. There has been a couple of things in the chat, but if you've got any other questions, please let us know. Thank you for listening.
Thank you. Thanks to all of you, Claire, Jane and Jen. Does anybody have any questions? Oh, getting a round of applause there.
Can I just come back to yours, Alison, that you put in the
Yeah,
chat? What
yeah.
about the implications of AI, fake social media accounts, fake posts in general? It's something that you've just got to recognise and acknowledge when you're capturing data online, that authenticity can be an issue. So in terms of my study, where I was looking at different types of bottles that they were using for breastfeeding, I think it was fairly obvious that some of the bottle companies were posing as parents and advertising the bottles to other mothers, etc. Because I looked across 3 forums and you could see exactly the same comments across. So I think, you know, it's nothing that you can't prove it, but it's about actually acknowledging that. And that can happen in qualitative research anyway. People can sort of be the person that they're not maybe in data capture, but this is much more difficult because you can't sort of scrape the surface. So as Jen said, looking at some of the analytics in terms of who's on the forums can be quite useful, but even then you've just got to acknowledge that you can't cover everything in terms of authenticity.
Can I add as well? I always use this as an example, but one of my interviews was with a forum moderator. So it was an online drugs forum who I interviewed because he was kind of giving out some very good harm reduction advice. During the course of the interview, he told me that he had 2 accounts. So one was his moderator account, but one was also his seller account. So he would go onto the forum as his seller and say, I've got, you know, X amount of DMP for X amount of money. And then he would log back on as his moderator account to kind of verify the seller and be like, oh yeah, trust this guy, he's brilliant. And this is going back a good few years now, kind of before AI has really taken off. So even then we were kind of battling with, is what we're seeing true? And obviously it's only getting worse. I think it can be, for kind of some of the in-depth qualitative research, it can be a little bit easier to pick, I think, because you're doing that kind of more in-depth analysis of a particular community. I think if you're doing your data scraping, I guess it's probably easier. Some of that is going to get picked up, and it's very difficult to do. I think, as Claire said, all you can do is acknowledge it. But yeah, just to say that's kind of been an issue with online data even before AI kind of really took off.
Thank you. I've learned some new words as well. Netnographers. Thank you for that. If there are no further questions, I think we'll move on to the poly poll. I think Ethan, could you help us out with poly poll, please?
Certainly will. Just give me a second.
Thank you. While he's doing that, I'd just like to thank everybody today, all our speakers, and for people joining us today. I think we've had a really interesting and thought-provoking networking event today. So yeah, Ethan, you're sharing your screen there.
Oh, sorry.
All right.
I believe the poly poll should have gone across.
Yeah. Can people see that?
Yeah.
Can everybody see that?
No.
It should be in the chat.
Yes.
Oh, it's in the chat now. Thank you.
Is it only showing the one question? Do I need to progress?
I
Or
think
does
you
it
need.
allow you
I
to
can see
choose?
all of them.
Yeah, you can just to let everyone know it's anonymous as well.
Yeah.
Yeah. Thank you. So if you want to have a quick go at that, it's just a few questions. I'm going to be biased.
Yeah, you're going to skew
Does
the
it let
data
everyone
out,
answer
Alison.
I'm
all the
skewing the
questions?
data.
Yeah. Sorry, Ethan, what did you say?
Sorry, everyone can progress through the questions, can't they? Then it's not
Yeah,
just stuck
yeah.
on the one.
So
Yeah, sorry, I just
it's
wanted
only
to make sure it wasn't just stuck on the one.
No, no, it's worked. Thank you. Just while people are doing that, if people have any thoughts about for our next session, are there any ideas or suggestions for our next qualitative session? If they want to pop that in the chat as well, that'd be good. Yeah, there's a question there. Is it hard not to get overwhelmed by the volume of data? Yeah, I was thinking that information overload, and people were saying they'd like to read some of your papers as well.
Oh, Jen or Jane, I'm useless as this. Should we put the links in the chat? Oh, I think they're on the slides, aren't they?
Yeah, on the slides. Yeah.
That information overload, I think it's about understanding that you've got to set sort of limits before you even start. You know, like Jen, that was a very rigorous sort of procedure before collecting the data, but you can see why. And also, obviously, like all qualitative research, aligning it to your aim, and really nailing down your population, or else, yes, information overload, which we can have anyway in quals, is just times 100 really. So
it's a bit like a systematic review process, isn't it? The way that you plan the data collection, and yeah.
And I think in terms of publication, it's really important to show that rigor. So yeah, we would always sort of advise to have some systematic approach. You're right, Selena.
Do you use mixed methods in the once you've got the data? Yeah.
Yeah, it lends itself quite well to the mixed methods actually, because you can capture, as Jane showed you on that slide, quants and quals quite easily.
Have you involved members of the public in the research process at all?
Not really. I haven't. Have you?
I sort of did it. It was a mixed method study, so it wasn't deliberate involvement. But what I did was the YouTubers that were selected for my study were actually selected from 1,000 school children from across the Northwest. They chose the most popular. That guided which YouTubers I used. And then I took some of the selected videos back to focus groups with the young people, and they talked through the findings with me and kind of interpreted them. So it was part of the research design rather than engagement, but it was guided by what the young people were watching at the time. Yeah.
Do you think it gave you a different perspective on what you would have said about the videos as opposed to what they said?
Absolutely, and also just the selection of what was popular, because that was changing so quickly at the time, that it was so hard for me to decide what was considered a popular YouTuber or not. So that was really interesting to get their views on what was popular at the time. Yeah,
it's probably a neglected area, that, you know, PPI in actual online data capture, isn't it?
Yeah.
I think for mine, it's partly because I went online because they're a hiding population. So trying to actually involve them is very, very difficult because they don't want to be involved. So I had interviews with kind of the forum moderators and then forum users afterwards, but it was very difficult to get involved, and people did not want to talk about weight loss drug use at all with me. So, and obviously COSINETS does have that kind of member check-in stage where you can go back and feed. So once you've kind of done your analysis, you can kind of feed that back to the members of that community to check whether they think that does kind of sum up their community. And that was kind of what I was trying to do, but I think, yeah, with not huge amounts of success, because they really didn't want to talk to me.
They didn't want to think about it too deeply.
No.
Okay, we've got 19 people that have responded, so we'll have a look at the poly poll. So 11 people thought that the networking event was excellent. I probably skewed that. 7 thought it was very good, and 1 thought it was average. Next question: how would you rate today's networking event? So majority of people found it useful or very useful. The next question was: has today's event informed knowledge on aspects of qualitative research? Overwhelmingly, 89% of people thought it had, and some people were undecided, and 1 person thought no. Okay, and whether today's event increased awareness of others working in qualitative research in the Northwest Coast. Overwhelmingly, 95% of people thought that it had. So that's great. Okay, thanks for that. That's brilliant. So there's nothing. Is there anything else in the chat? Yeah. So yeah, like Kirsty says, thank you for responding in the poll. It really does help us to have that feedback. And please, like Kirsty says, if you have any ideas or suggestions for our next event, please let us know. So I just want to thank Lisa Knight, Kirsty Coxton, Claire Selby, Shane Wallace, Claire Maxwell, Jane Harris and Jen Germain for all of their contributions today, and for Ethan for guiding us along and keeping us on track. So I'll give you 5 minutes of your life back.
And thank you, Alison, for keeping us on the straight and narrow, organising this event. Thank you so much.
Very welcome. Thanks, everybody. Take care.
Everyone. Bye-bye.
Bye.